patient, Mrs. RB. She's a 52-year-old woman who is diagnosed with type 1 diabetes mellitus. She was also diagnosed with hypertension 4 years ago. According to her son, a couple days ago, she walked 5 blocks to the grocery store, came home with a big open wound on her foot that was very black and blue.
Well, PAD seems like the most obvious diagnosis.
What makes you say that?
PAD, also known as peripheral arterial disease, makes the most sense when we look at her signs and symptoms. Most common symptoms for PAD are pain in legs with exertion, like walking, which is relieved by rest, but there's also leg numbness or weakness, coldness in your lower leg or foot, sores on your toes, feet, or legs that won't heal, and a change in the color of your legs.
Alright, well let's run the test for PAD then.
Okay, let's go see what Dr. Kendall has to say.
Sounds good.
When diagnosing for PAD, there are a few different methods that could be used. First would be the ankle brachial index, which is a non-invasive test that measures the blood pressure in the ankles and compares it to the blood pressure in the arms at rest and after exercise. You can also use imaging tests such as ultrasound, MRI, and CT scan. Here is an example of a patient with PAD.
So this is what we did for Mrs. RB. We had a magnetic resonance angiograph of the lower right extremity, and a right tibial artery obstruction was identified. From there, we had a broad spectrum of antibiotics. Her wounds were packed with saline-soaked Kerlix gauze to facilitate debridement of necrotic tissue, and the patient was provided with continuous insulin by IV to monitor blood glucose concentrations.
Yeah, and if you see, looking at her file, it looks like she underwent a successful angioplast of the diseased vessel, and they placed a stent in to restore blood flow. And she's recovering now through bed rest and continued antibiotic therapy. And so through this, we were able to actually save her right foot from amputation. Did you know that in the U.S., about 4.3% of adults over the age of 40 and about 14.5% of adults over the age of 70 suffer from PAD? More than 95% of people with PAD have one or more cardiovascular disease risks. Individuals with PAD are at risk for developing coronary artery disease and cerebral vascular disease, which is associated with higher risk of myocardial infarction, stroke, amputation, and death. And a total of $4.37 billion was spent on PAD-related treatments.
Here are some of the necessary precautions patients with PAD should take. So, first of all, they should quit smoking. They should also exercise regularly, and this includes walking, swimming, or biking. They should eat heart-healthy foods like vegetables and fruit, and they should stay at a healthy weight and lose weight if they need to. They should also take medications that lower their cholesterol, monitor their high blood pressure, control their blood sugar, or prevent blood clots.
And this is the elevator conclusion for your mom.
PAD is a disease in which plaque builds up in the arteries that carry blood to your limbs, that limits oxygen to your organs and other parts of the body.
If you smoke, have diabetes, high blood pressure, or high cholesterol, you're more at risk to get PAD.
PAD is bad. Narrowing of arteries brings pain in the legs.
Good job, guys.